Thank you for joining us today in our discussion of the facilities for the Medical Physics Consulting Residency Program. The first year spent at the St. Francis Cancer Center. The St. Francis Cancer Program was established in 1975 in honor of Natalie Warren Bryant, second daughter of hospital founders Mr. and Mrs. William K. Warren Sr. Today, by combining the Cancer Center's medical and other clinical teams' expertise and specialized knowledge, a comprehensive care management plan is developed to meet the individual patient's needs. The members of the residency program who work at St. Francis are Charles Stewart, the Program Medical Director and Medical Director for Radiation Oncology, Russ Gerber, the Chief Executive Officer, who serves on the Admissions Committee, Lindsay Webb, the Assistant Program Director, who chairs the Admissions Committee, Chris Brown, the Program Mentor and the first face of the program for the Year 1 resident, and Tylene Smith, who is the Department Manager for Radiation Oncology for St. Francis Cancer Center. A significant portion of the residency is dedicated to clinical training. Residents work under the close supervision of experienced medical physicists in clinical settings, such as the St. Francis Cancer Center. They actively participate in patient care, treatment planning, quality assurance procedures, and radiation safety practice. This hands-on experience allows residents to develop practical skills and understand the clinical workflow. During Year 1 of the program, the residents' 4 rotations will focus on dosimetry and treatment planning, radiation production and detection, calibration of radiation sources, treatment planning systems, both commissioning and verification. As the residency begins, the program starts with the treatment planning process. St. Francis utilizes a Philips Big Bore Brilliance 64-slice scanner with Varian's Respiratory Gating for Scanners, RGSC motion management. CT simulation is the backbone for many treatment planning processes and correlation with outside imaging. St. Francis Cancer Center has Varian's Eclipse software, which is in use in thousands of cancer treatment centers around the world. Eclipse optimizes a radiotherapy treatment plan based on a physician's dose instructions and information about the size, shape, and location of the tumor to be treated with radiation. The treatment plan becomes the basis for electronic instructions that tell the radiotherapy machine how to deliver the treatment, such as what angles to use, how many monitor units to deliver from each angle, and how the treatment beam should be MLC shaped to match the shape of the tumor. Algorithms used in addition to the optimizer and image registration presets are Acuros XP, AAA, PDIP, and Electron Monte Carlo. Elekta's Mosaic is used to house the documentation and send the DICOM plans to the treatment machines. Documents are kept with dose tracking and fraction information in a separate database along with offline image review. Elekta Mosaic integrates with medical oncology seamlessly. Mosaic provides the information from the treatment planning system to one of the 3 linear accelerators at St. Francis Cancer Center. The St. Francis Cancer Center has a Varian iX. The Varian iX is Varian's workhorse machine with a long-standing history of reliability in treating patients. The iX comes with a variety of upgrades and options, many of which are still considered clinically relevant, such as Varian's Rapid Arc Dynamic Delivery Method, Cone Beam CT, RPM gating for imaging and delivery, and optional surface-guided radiation therapy packages. The St. Francis Cancer Center also has 2 of the newer platformed TrueBeam linear accelerators. The TrueBeam system combines advanced imaging and precise radiation delivery capabilities, allowing radiation oncologists to deliver highly targeted and accurate radiation treatment to tumors while minimizing damage to surrounding healthy tissue. Some of the key features and components of the Varian TrueBeam are image-guided radiation therapy, rapid arc technology, high-intensity treatment options in flattening filter-free beams, respiratory gating, motion management. One of the TrueBeams at St. Francis Cancer Center is commissioned to use the SRS cones for frameless treatments. In addition to farmer chambers, scanning microchambers, and diodes used in commissioning and annual work, the St. Francis Cancer Center uses Daily QA3 integrated into a common database from the SunCheck software. St. Francis Cancer Center routinely uses TG142 imaging phantoms for KV and MV image quality testing, in addition to the vendor-supplied CAT fan, patient vivo dosimetry with the MicroStar OSLD nanodots, and the SNC 3D dosimetry round tank and 1D tank with PC electrometer. St. Francis Cancer Center, as a part of Medical Physics Consulting, is excited to be working with RadFormation in setting up RadMachine. RadFormation aims to streamline and automate various aspects of the radiation therapy treatment planning process, ultimately improving efficiency, accuracy, and patient outcomes. They have developed software tools that integrate with existing treatment planning systems used by radiation oncologists and physicists. In RadMachine, you can access all machine QA data on a streamlined, cloud-based platform to perform, review, and track multiple QA data streams, all at once. Automatically upload the data for any machine QA test or frequency from Varian's Machine Performance Check, Sun Nuclear's Daily QA3, a file directory, or the Record and Verify system right in your browser. To summarize, the resident will gain experience in CT simulation, routine treatment planning in Eclipse, several specialty treatment procedures, and an introduction to the treatment machines. At the end of year 1, the resident will have a working knowledge of the basic technologies and techniques used in external beam radiation therapy. The resident should have a strong foundation in the use of radiation measurement devices, QA of these machines, and the ability to build a predictive model in a treatment planning system for patient therapy. Year 2 starts in Joplin immediately following and is in the next video. Thank you.